Hello guys, welcome to Pajon Imaging Hub. In today radiographers health professionals education series in how to do series, we'll look at arterial heart chamber enlargement. Please don't forget to like, share and subscribe to this channel so that you'll be notified when new video is released. Thank you. Welcome back. Right arterial enlargement. What are the features you look out for when you are looking at the chest X-ray to know when there is right arterial enlargement? In this video, we're not going to dwell on causes of right arterial enlargement or chamber enlargement. Maybe we will do that in another video. But we just want to look at the radiographic features that we can use a common X-ray, chest X-ray to show when there is a chamber enlargement. Right arterial enlargement. These are the features you look out for. The right arterial border is more convex than normal. We'll look at how normal convexity of right arterial border in normal chest X-ray look like, so that you'll be able to know when it is abnormal. Then this right arterial border should not be in a right arterial enlargement is more than 50% of the cardiovascular height. We'll look at how to do that. Then it should be more than 5 to 5.5 cm from the midline. The last but not the least feature is that it should be more than 3 cm from the vertebrae. Let's look at how to detect or determine these things we've just mentioned. Now this is a normal chest X-ray. You see how the right heart border looks like. You see about 1/3 of the heart is on the right side. Then when you look at these enlarged heart, you see the convexity. The blue line there is the convexity we talked about of the right heart border. Then the A is the distance from that convex to the lateral border of the right border of the vertebrae. It should be more than 3 cm for us to say that this heart is enlarged. But this specific thing can be affected by radiographers' techniques. In the case where there is rotation, you may find out that this may still be up to this amount. Then the B line is the midline. Is it from the convex to the midline? You see, it has to be up to and more than 5 to 5.5 cm for us to say that there is a right arterial chamber enlargement. Now look at other features, how the image look like. This is the cardiovascular height, this vertical line. Then you can see the convex right arterial border. So the length of this convex line should be at least 50% or more of this cardiovascular height for us to say that there is a right arterial chamber enlargement. So you see how it's easily depicted or illustrated. That is how to detect right arterial chamber enlargement. So let's look at left arterial enlargement. In left arterial enlargement, there'll be elevation of the left main bronchus. We'll see that in a moment. There is a splaying of the carina. Then there is the third one, a stretching of the left heart border below the left main bronchus. Then double right heart border sign. You will see that in a moment. Then the last but not the least is measurement from midpoint of the right heart border of left atrium to midpoint of left main bronchus is greater than 7 cm. So let's look at the images to see what we talked about. Now we see the bronchus, the main stem bronchus. You see this one and this one. This one is elevated superiorly, while this one is inferior. It's normal. It looks, even though there is also a right arterial enlargement, but compared to this one is more elevated. That's what I'm trying to say. Then you look at the double wall signs. If you look closely, you see there is a double wall sign here. You see the density is different. So I illustrated it here so that you can compare the two images and be able to determine these signs. You can see the two different lines. See, one is showing the border of the left atrium, the right border of the left atrium, while this one is showing the border of the right atrium. This line is the strengthening, is illustrating the strengthening of the left heart border below the left main bronchus, or the left below the left pulmonary vasculation. See this pulmonary vasculation here is supposed to be a concave, or slightly concave, this place, but it's straightened because of enlargement of the left atrium, this particular place. It's supposed to be flat or less, or little or slightly concave, but you can see we can't appreciate any concavity in this portion. It's straightened and bulged out. So that is due to left arterial enlargement. This is the splaying of the carina. You see this place. You see this illustration. In a normal X-ray, which I will still look at in a moment to show some other things to help you to understand what I have explained in this cardiac enlargement. You will see this splaying of the carina. You see this carina angle is increased. It's up to 90 degree. You see this the line I was telling you about. You measure you measure from the midpoint of the right border of the left arterial chamber. This line, this converse line, the midpoint. Then you measure to the midpoint of the left main stem bronchus. You see the left stem main stem bronchus. You see it here before I start branching here. So you draw the line. You measure from midpoint here to the midpoint here. This line should be more than 7 cm. For us it is a sign of left arterial chamber enlargement. So these are the things we'll put together to be able to make this diagnosis. Then before I close this lecture, I want to quickly show you the normal X-ray again. I want to point out some stuff to you. Now you see the carina angle here. You see how it is compared to the one I just showed you. Then I want to let you know of this for beginners. The right heart border. This is the heart. The right heart border is mainly border of the right atrium. The left heart border is that of the border of the left ventricle. We don't see or appreciate the left atrium in PHS X-ray, and we don't appreciate the supposed area of right ventricle in PHS X-ray. So this border you're seeing is right atrium. This border you're seeing is left ventricle. Is very important. But in lateral chest X-ray, you can now appreciate the other borders of the chest. Let's bring us to the end of this lecture. Thank you. Like, share, and subscribe to this channel so you'll be notified when new video is released. Bye for now.